Everything you need to know about influenza: prevention, symptoms, and treatment. Influenza, more commonly known as the flu, is a highly contagious and serious respiratory illness that infects millions of people each year. It can cause a range of symptoms, from mild to severe, and in rare cases can even be fatal. Knowing the signs and symptoms of the flu and how to prevent it is essential to staying healthy. Fortunately, there are a variety of treatments available to help reduce the severity of symptoms and shorten the amount of time someone is ill. In this article, we'll discuss everything you need to know about influenza, including prevention, symptoms, and treatment options. Keep reading to learn more and stay healthy this flu season. What is influenza? Influenza is a contagious respiratory illness caused by a virus. It's characterized by a fever, cough, and sore throat. In severe cases, it can cause severe complications, especially in older adults and those with certain health conditions. Although seasonal influenza occurs throughout the year, it's most prevalent during the winter months. The flu is caused by a virus. There are many types of influenza viruses. The flu vaccines currently on the market are designed to protect against one type of influenza virus. Influenza can be caused by a number of different viruses. While it's common to have different strains of influenza circulating at the same time, it's not possible for someone to contract more than one strain of flu at a time. For example, there may be an influenza A virus circulating that is not causing many people any symptoms, while another strain of flu virus is causing plenty of people to develop symptoms. Influenza symptoms. While the specific symptoms of the flu will vary from person to person, they usually begin with mild symptoms, such as fever, fatigue, muscle aches, headache, sore throat, and nausea. These symptoms can last anywhere from 1 to 2 weeks. In more severe cases, people may experience severe fatigue, vomiting, loss of appetite, body aches, and/or difficulty breathing. The symptoms of the flu can also make people feel very weak and tired. This can make it difficult to get things done and can make it more likely that someone will miss work or school. It's important to rest as much as possible during the first 48 hours after getting the flu so that a person doesn't become even sicker. There are many things that people can do to help prevent the flu and reduce the severity of their symptoms. It's important to drink plenty of water, eat healthy meals, get enough rest, stay away from people who are sick, and wear a mask or use an air humidifier whenever possible. It's also helpful to get vaccinated against the flu as soon as possible. How to prevent influenza? Preventing the flu involves several steps, including staying hydrated, getting enough sleep, and eating healthy foods. It's also essential to get enough exercise during the winter months, as getting physically active helps boost immunity and reduces the risk of contracting the flu. It's also important to wash hands frequently. When a person is sick, they often touch their nose, eyes, mouth, and groin, which means they should pay special attention to those areas when washing their hands. Washing hands can reduce the chances of spreading germs to others significantly. It's also helpful to wash hands for at least 20 seconds and use soap for at least 20 seconds. It's also helpful to clean surfaces where a person is likely to touch things, such as kitchen counters, keyboards, and doorknobs. Washing these surfaces with proper sanitizing products can help reduce the risk of contracting a bacterial infection. Diagnosing influenza. People with the flu will typically feel sick and will have a fever. However, it's easy to overlook the signs of the flu because the symptoms often feel similar to other illnesses. Therefore, it's important to see a doctor if someone experiences fever, cough, fatigue, muscle aches, or a sore throat. A doctor can determine if someone has the flu by taking a blood test or doing a throat culture. If a doctor suspects a bacterial infection, they can treat it with antibiotics. If a doctor suspects the flu, they can treat it with antiviral drugs, such as Tamiflu or Relenza. It's also possible for a doctor to prescribe antibiotics if a person experiences bacterial symptoms, such as a cough or pain. Treating influenza. There are many treatments for influenza, and it's always important to undergo proper testing to determine the best course of action. The first step is determining whether someone has the flu or bacterial infection. This can be done by taking a throat culture or blood test. If a doctor determines that someone has the flu, they will likely recommend the use of antiviral drugs, such as Tamiflu or Relenza. These drugs reduce the amount of time that someone is sick and can shorten the severity of common flu symptoms. If a person has bacterial symptoms, such as a cough or pain, they will likely be prescribed antibiotics. It's also important to note that if someone is young or healthy, they should avoid taking non-prescription pain relievers, such as Tylenol or Aleve, as they may mask the symptoms of the flu. When to seek medical care. If you experience any of the symptoms of influenza, including fever, muscle aches, or a sore throat, it's important to see a doctor. It's also important to see a doctor if a person is feeling weak and has a fever that lasts longer than 3 days. In these cases, it's important to make sure a doctor knows that a person is sick, so that they can be properly treated. If a doctor determines that someone has the flu, they will likely recommend the use of antiviral drugs. These drugs, such as Tamiflu or Relenza, can reduce the length of time that someone is sick and can shorten the severity of symptoms. It's also important to note that Tamiflu and Relenza can reduce the amount of time that someone is contagious, which means that a person can go back to work or school more quickly once the flu starts to fade. It's also possible that a doctor can diagnose bacterial infections, such as bronchitis or pneumonia, that are causing a person to feel sick. Prognosis of influenza. The outlook of someone with influenza is typically good, as most people recover and aren't even aware that they were even ill. In rare cases, however, someone with influenza can develop complications, such as pneumonia or a heart attack. It's important to remain hydrated, get enough rest, and eat healthy foods so that a person doesn't develop any complications and can get back to their normal routine. Luckily, most people will feel better within a week and won't even know that they were ever sick. The important thing to remember is to stay hydrated and get plenty of rest so that a person can avoid developing any complications.